Okay, let's start by talking about the instruments you'll be using to dissect the cat. And I'm going to go through each instrument and describe to you how to use them. Okay, so let's start with the probe. In this box we have two kinds of probe. We have a probe that has a blunt end and a beveled end. Probe can be used as a pointer. For example, you're going to point to a muscle instead of using your fingers. This is more professional. You can use to lift up muscles. And of course you use the other end for the same purpose, for lifting and pointing. In addition, you can use the blunt, the beveled end to cut away at soft connective tissue as well. Okay, it will break soft connective tissue easily. The other kind of probe we have here is this probe. And as you can see, it has a pointy end, and for this you can actually pierce the flesh and it will stay in place. For example, let's say I want to reflect this flap of skin right here, but I want to keep it in place. So I can use the sharp end and do that, and it will hold in place. We usually use this a lot when you take a test to show the muscle of interest. Okay, and then when you're done, you can move it out of the way, remove it, and put it back in. The next instrument let's talk about would be the tweezers. We have this kind of tweezers, and we have this other one. What's the difference? Well, basically the ends. If you look closely here, the ends on this has little pointy, triangular shaped point so that you can grasp things easier. For example, the pointy thing makes it easier to hold whatever it is that you're trying to hold. The other tweezer does not have that. It is more of a flat shaped head. So it does its job well, as it's pretty well, but it depends on what type you want. You can use either one. And remember, always try to hold the tissue with tweezers. Don't try to hold it with your finger like this. Okay, this is a major no-no. So use tweezers or use pickup to hold whatever it is you need to hold back. Okay. Next up is scissors. Okay, now scissor for cutting, as you already imagined. Okay, scissor for cutting. Notice that in this particular scissor we have a sharp end and a blunt end. Okay, when you cut, you want to always cut with the blunt end down, because if you cut with the sharp end down, you may be piercing structures that you don't want to pierce. For example, let's go to this cat, and I'm going to use the pickup to reflect the skin. If I was to cut, I will not go down this way because the blunt end is up, the sharp end is down, and I don't want that because I might accidentally cut through the muscle. What I want to do is I want to hold the scissor this way with the blunt end of the scissor down so that it won't bisect, or it won't pierce, or won't cut anything by mistake. So always cut with the pair of scissors with the blunt end down. Okay? And lastly, we have the scalpel. Okay, this is a scalpel. As you can see, it has a very, very sharp blade. Okay, and the handle. So to hold the scalpel is this way, and you're going to cut obviously with the sharp end toward the area of interest. I will use the scalpel as the last resort. Okay, because if you're going to be cutting, unless you know exactly what you're cutting, the scalpel oftentimes does more damage than good. You will cut things that you want to keep accidentally, and then it's too late. You can't exactly sew it back. So always use the scalpel as the last minute. The other thing I want to talk to you about is how to change the scalpel blade. Sometimes your box of dissecting kit will come with extra blade. You do not change the blade with your fingers. Okay, you change the blade with the tweezers, the pickups. For example, let's say I want to change the scalpel blade. Well, first of all, you want to hold the scalpel so that the blade is away from you. Then what you do is you will, here, let me kind of switch hands here. What you will do is you will use the pickup and lift up the blade by the end here. Okay, you're going to use the pickup, lift up the blade a little bit, and now you can grasp the end of the blade. With that, we will push the blade in this direction, and with that, it should get off. There we go. As it comes off, you can then deposit the blade in the sharp container. Let's try to put the blade back onto the scalpel handle. Notice how I'm holding the blade. Make sure that the sharp edge is away from you, and always hold with the tweezers or the pickup. Then you're going to hold up the handle of the scalpel, and we're going to insert the blade so that it slides into this little oval area here, you can see. Okay, so we're going to go in this way, and we're going to slide it inward. Now sometimes it won't come, so you may have to press down on it a little bit with tension, and then it snaps into place. Obviously, always use a hard surface when you're pressing in so that it will go in easily. Okay, so that's the scalpel. One last instrument I want to point out is this one right here, and this is the hemostat. It looks like a curved pair of scissors. If you notice, curved at the end, has holes for your fingers to go through. The difference between this and scissors is that this is not a cutting instrument. This is a holding instrument. Okay, tweezers was another holding instrument that we talked about already. But the problem with tweezer is that your finger will get tired after holding like this for a long time. If that's the case, use these. These are hemostat, because what you see is there are ridges here, and the ridges will allow this thing to snap and hold in place. So for example, you're going to have to release the tension. Let's say I want to hold this once again. I'm going to clip onto it. I'm going to click to hold it tight, and at this point it's easy to hold like this, and you can hold it like this for a long time without having your hand gets tired. Okay, so let's go to the cat now and see what we can do with this. Well, first of all, if we were to begin, let's say we're going to perhaps use this, the hemostat, to hold back and see where we're going. I would then possibly use a probe. Okay, I will use a probe, and I will insert the probe underneath the skin, because we're going to try to loosen the skin, loosen the pelt from the muscle underneath. So you see what I'm doing? I'm inserting the blunt, the rounded end of the probe, and I'm wiggling it a little bit to loosen the pelt. Okay, as you do this, see how it's getting further and further. I'm going further and further. At this point, I will take the scissor, and I will, remember, with the blunt side down, okay, always cut with the blunt side down, I'm going to cut along the probe. So for example, with this, blunt side down, go alongside the probe, and I'm going to cut the pelt. Okay, at this point, I can use the other pickup, and now we can see there's a lot of connective tissue underneath here that we got to remove. Okay. At this point, you can use the probe once again. Okay, always do blunt dissection because you do less damage. And with the blunt probe, I can do this and break the connective tissue underneath the pelt. Remember, we're trying to stay very superficial, because the deeper you go, the higher your chances of running into muscles that you want to learn. So doing this, you're going to cut the connective tissue, but not damage the muscle of interest. Okay? You can also use the other side of the probe, which is the flat side, and do the same thing. Okay? Cutting through connective tissue. And this is usually the technique of, that we want you to use. Remember, do not use a scalpel unless it's the last resort.